Good day, everyone. We will be discussing the old age, which talks about death, dying, and bereavement. In this chapter, we will examine the ways that conceptions of death differ and develop across childhood and adolescence, as well as the process of grief and bereavement, and the factors that influence how they unfold and are resolved. And now, I will be discussing about the phases of dying. Number one is agonal phase. So, before we go to a deeper meaning of agonal phase, let's define what is agony. Agony is intense pain of mind or body o matinding paghihirap. Kaya doon kinuha yung term na agonal phase in which it is a gasp and muscle spasms during first moments in which regular heartbeat disintegrates. Agonal breathing or agonal gasp are the last reflexes of dying brain, and they are generally viewed as sign of death and can happen after the heart has stopped beating. Next is clinical death. Clinical death, it is the interval in which heartbeat circulation, breathing, brain functioning stops, but resuscitation still possible. Its example are anoxia and hypothermia. May live for more than 5 minutes after the cessation of respiration and circulation. And the last for phases of dying is mortality. Mortality is a permanent death or the state of being mortal. We are destined to die. So now, let's proceed to defining death. Number one is brain death. Brain death is irreversible cessation of all activity in brain and brainstem. Second, it is the standard for death in most industrialized nations. Or it means that they will not regain consciousness or be able to breathe without support. It is a person who is brain dead, or a person who is brain dead is legally confirmed as dead. And ang pangalawa naman po is PBS or persistent vegetative state. Ano nga po bang ibig sabihin nito? It is sometimes also called coma. Naririnig po natin to kapag yung isang tao ay hindi agad-agad makapagsalita or mulat or na ano siya ng ilang years or ilang months bago magising. So, yung tinatawag na coma or a profound or deep state of unconsciousness. At meaning din po ng PBS is cerebral cortex no longer registers electrical activity and brainstem remains active. In simple meaning, persistent vegetative state is not brain death. So now, let's proceed to death with dignity. Dignity is associated with worth or esteem, so death with dignity means that integrity of person's life is fostered by the quality of communication with and care for dying person. Number one is assurance of support, compassionate care, esteem and respect, candidness about death's certainty, information to make reasoned end-of-life choices. So next is concept of death. There are 5 concepts of death, which is the permanence, inevitability, cessation, applicability, and causation. So number 1 is permanence. It is the understanding that death is permanent state from which there is no return to life. Number 2 is inevitability. It came from the word inevitable, meaning a situation that is unavoidable o tiyak na mangyayari. Kaya, inevitability is the understanding that all living things must die eventually. And third is cessation, meaning being brought to an end or sa Tagalog, paghinto. Kaya, it is the understanding that all bodily processes cease to function upon death. And number 4 is applicability, means the quality of being relevant or appropriate, yung understanding that only living things can die. Number 5, the last one, is causation, the understanding that death is ultimately caused by a breakdown of bodily function.
In the early adulthood, various age groups have different levels of fear and anxiety in maturity when it comes to death. Early adulthood's lower total death rate contributes significantly to this group's lower death fear levels. In the middle adulthood, the fear of dying is greater in middle age than it is in either early or late adulthood. Middle-aged people's concerns are greatly influenced by their caregiving obligations. In the late adulthood, despite common assumption, people in their late adulthood exhibit less dread of dying than other adults. Despite being so near to passing away, first off, elderly folks are less concerned about leaving family members alone and have fewer caregiving duties. Additionally, they have had more time to finish the plans they had made for their lives, and they are aware that there won't be as many opportunities for them in the future. According to the death anxiety graph adapted from Tomer, Ellison, and Smith in the year 2000, women in the early adulthood have the highest mean of death anxiety with a total mean of 50 compared to men with a mean of 45. On the late adulthood, also women have a higher mean of death anxiety than men.
Elizabeth Kubler-Ross was a Swiss-American psychiatrist and the creator of the Kubler-Ross model, which describes her five-stage theory of grief. She was also a pioneer in the field of near-death experience. Kubler-Ross theory, first denial. According to Kessler, there is a grace in denial because it allows us to spread the sorrow over time rather than having it all come at once and leave us in shock and bewilderment at our loss. While trying to convince oneself that a loved one is still alive would be literal and dysfunction form of denial. I stress that the inability to accept the loss for the while is good and not something you need to snap out of right afterward. Second is anger. Another typical response to loss in anger, which can be directed towards the cause of death, the disease, your God, yourself, or the arbitrary nature of universe according to Kessler. Anger is the protector of pain we use in express our anguish, he said. The stage allows people to express their anger in constructive way and understand that it's okay. Third is bargaining. Negotiating after loss generally entails if only statements that are concentrated on regrets about what you did or didn't do before the individual passed away. According to Kester, this type of bargaining is frequently also motivated by guilt. Fourth is depression. When the significant loss start to have a greater impact on your life, you may express depression or severe grief. Perhaps you have been withdrawn from life or are thinking in life is worth living alone. Perhaps the sadness seems to last forever. Lastly is acceptance. Acceptance does not imply that you approve of your loved one's passing. It just implies that I have come to terms with the new life situation. Grief doesn't cease with acceptance either. According to Kessler, you might experience several fleeting moments of acceptance through life, such as when you organize and participate in funeral. Evaluating Kubler-Ross. Kubler-Ross' model was based on her work with the terminally ill patient and has been the subject of debate and criticism in the years since, mainly because people studying her model mistakenly believe this is the specific order in which people grieve and that all people go through all stages. The kind of death a person might choose for himself or herself if they're given a choice. The kind of the missed person may select for themselves, given the option in keeping with the way of life of the individual, needs and belief of people who are nearing the end of their lives, the type of that person could elect for themselves. There are four types of death: physical, psychological, social, and anthropological. So physical is like accident, suicide, homicide. Psychological is the person begins to accept their death and withdraw from other psychological. Social is racial and gender exclusion, persecution, slavery, and apartheid. Anthropological is examine the diversity and commonalities in how human society responds to the demise of its member. Factors that influence through thoughts about dying: social, cultural, religious, spiritual, psychological, emotional factors, illness, individual perception, personal attitude of death and dying, communicating with dying people, avoid jargon and unclear language. For example, say dying instead of passing away. Find out how they express discomfort or pain. Allow enough time for conversation. Be patient and ready to repeat yourself if needed. Check the understand by asking them to repeat what you said using their own words, if possible. Avoid barriers between you and the person you talk with. Tradition, place of death: home, hospital, nursing home. Hospice approach: a program that gives a special care to people who are near the end of life and have stopped treatment to cure and control their disease. Hospice offers physical, emotional, social, and spiritual support for patients and their families. They focus on care, comfort, quality of life. Person with a serious illness who is approaching the end of life, possible to cure serious illness, and may choose not to undergo certain treatments.
Four types of euthanasia. The first is the passive euthanasia, wherein you let the patient die without holding a life support such as ventilator or feeding tube. One of the drugs that is used in passive euthanasia is morphine, wherein you give the patient a large doses of morphine to control pain in spite of the livelihood that the painkiller can cause a fatal respiratory problems. So next is the voluntary active euthanasia. This can include administering high doses of painkillers that hasten death or providing and injecting a lethal substance or dose to end life. For the third one is the assisted suicide, the act of deliberately assisting another person to kill themselves. If a relative of a person with a terminal illness obtains strong sedative, knowing the person intended to use them to kill themselves, the relative may be considered to be assisting suicide. For the last form of euthanasia is the involuntary active euthanasia. It happens without the consent of a patient. For example, if the patient is unconscious and his or her wishes are unknown, some people distinguish between involuntary or against the patient's wishes and non-voluntary without the patient's consent but wishes are unknown form. So for our next slide is the international public opinion on voluntary active euthanasia. So as you can see, 70% of the people in the United States voted for voluntary active euthanasia, and 75% in Canada, 78% in Australia, 82% on Great Britain, and 90% on Netherlands. So next is the advanced medical directives that are written statements of desired medical treatments in case of incurable illness. Living will is the specific desired treatment. Durable power of attorney authorize another person to make healthcare decisions of one's behalf. It is more flexible than living will and can use or ensure a partner's role in decision making even in the relationship is not sanctioned by law. For the assisted suicide, the doctor will provide a drug for patient to use. It is only legal in 4 U.S. states. Okay, so let's move on to the grieving process. First is the avoidance. Avoidance is generally considered an adaptive response to loss and an integral component of the initial acute grief or response. This avoidance may be both situational or stimuli that are reminders of the loss and avoidance of emotion about the loss. Loss, ibig sabihin pagkawala. So next is the confrontation. It is the time of readjustment during the reality of the loss become harder to ignore. So lastly is the restoration. During this phase, it's common to feel grief more intensely than in an initial stage. The reminders of the loss can be painful and frequent. The restoration-oriented process incorporates endurance through reconstruction of perspective by taking over grief. Grieving thoughts are adjusted adaptively by creating a new meaning with the deceased. The restoration process is a confrontation process that allows the person to adjust to the world without the deceased. Okay, so for the sudden or anticipated are the avoidance from shock and disbelief. Survivors may not understand the reasons, and suicides are hard to bear. So for the prolonged or expected is that anticipatory griefs allow emotional preparation and reasons to death are usually known. We have some difficult grieving situation that is are the parents losing a child, children or adolescents losing a parent or sibling, and an adult losing an intimate partner or bereavement overload. Okay, so let's proceed on the next slide. Talks about the bereavement intervention. So first is the general support needs sympathy, understanding, patience, listening, and being there. And next is the intervention and support group who helps with reorganizing daily life. On the children and adolescents, after a violent death, prevent unnecessary re-exposure. And lastly, the difficult situations, sudden violence, unexplained or ambiguous death are also difficult situations. So you must need a grief therapy or individual counseling. So on resolving grief, you must give yourself a permission to feel loss and just endure the pain. Accept social support in order for you to overcome the situation easily and be realistic about the course of grief and remember the deceased. And when you are ready, invest in a new activities or relationship. But always remember that don't use another person or another individual for you to move on easily. And lastly, master a new task on daily living. So that's all for our discussion and thank you for listening.